Stop the Bleed is a program that teaches people how to control severe bleeding. These skills can be learned by anyone and may help save a life. By the end of this video, you should be able to identify bleeding, react to the emergency safely, and stop the bleed. Bleeding emergencies can happen anywhere, whether a kitchen accident, a work accident, or a car crash. Be prepared wherever you are. Personal safety is very important. First, ensure your safety before helping others. If you become injured, you will not be able to help others. Only help others when you find it safe to do so. If you feel unsafe, wait for the first responders, which includes fire, police, and ambulance services. If the situation becomes unsafe, stop. Ensure your personal safety and take the victim with you if you can. Protect yourself from blood. Use plastic gloves to keep the blood off your hands. If you touch blood that isn't yours, clean your skin with warm soap and water. And if anyone is entering the scene, let them know that there is blood and allow them to take appropriate precautions. Healthcare providers can let you know the next step to take to prevent you getting sick from the blood. Call 911 immediately. Know your location and follow the instructions provided by the 911 operator. Answer the dispatcher's questions as best you can. After alerting 911, finding and controlling the source of bleeding is a very important step, ensuring the bleeding from an injured person is controlled or stopped. As an immediate responder, you will maintain the steps you are using to control bleeding until first responders arrive. When locating sources of bleeding, there are 3 things to consider. Look for continuous bleeding, large volumes of bleeding, and the pooling of blood. Also, there may be cases when there's more than one source of bleeding. Life-threatening bleeding can be concealed by clothing, so it is vital that you check for all sources of bleeding. Bleeding can occur anywhere on the body. Common places where life-threatening bleeding occurs are at the arms and legs, torso, neck, armpits, and groin. There may be more than one source of bleeding. Bleeding can occur anywhere on the body and may be hidden by clothes. You may need to touch the victim, turn them over, or remove clothes to find bleeding. To control bleeding, use gauze, a towel, or cloth to apply direct forceful pressure to the wound. Continue compressing until the bleeding stops. The victim will feel pain. Once bleeding is controlled, maintain pressure until first responders arrive. If applying pressure isn't effective in controlling the bleeding, the source of bleeding may be from deep within the wound. Pack the wound tightly with gauze or other absorbent cloth. After fully packing the wound, apply direct forceful pressure to the wound and maintain it until first responders arrive. A tourniquet is a device for stopping the flow of blood through a vein or artery. Apply the tourniquet to an extremity, such as an arm or leg. Open up the Velcro band and place the tourniquet 2 or 3 inches above the wound. Wrap the band around the entire arm or leg. Pass it through the buckle and pull it tight to remove any slack. Avoid placing the tourniquet on joints or other bulky clothing. Turn the rod to tighten the tourniquet until bleeding stops. The tourniquet may need to be tightened more than expected to stop the bleeding and will cause pain for the victim. Secure the rod to prevent the tourniquet from loosening. Check to make sure the tourniquet is tight and effective. If bleeding doesn't stop, apply a second tourniquet above the first one. Do not remove the tourniquet. Tourniquets can be applied to all limbs shown in blue. A tourniquet can be applied over light clothing. However, remove any bulky clothing that may prevent contact with the limb. If the tourniquet is being placed over a pocket, empty the pocket first. If bleeding occurs on the joint or in an area such as the neck, chest, or groin, use direct pressure and packing only, but not a tourniquet. Products designed as tourniquets are proven effective and are better than improvised tourniquets, as are direct pressure and wound packing. Use improvised tourniquets as a last resort and only if all else fails. Here are some questions. Can these bleeding control techniques be used on children? Yes. The same techniques apply to children as to adult patients. What should I do about impaled objects? Do not remove the impaled objects. Use gauze to stabilize the object and apply direct pressure around the wound while making sure you do not press on the impaled object. Can you lose an arm or leg from a tourniquet? It is more likely a person will bleed to death if the tourniquet is not used than lose a limb if it is. It takes hours of wearing a tourniquet before a limb is damaged. Is pain expected? Yes. Bleeding control is painful unless the patient is in shock. If the patient is conscious, you should warn them to expect pain. Does this class give me a completed certificate? This online tutorial is for information only. If you want a certificate proving you know these techniques, in-person classes that have you practice bleeding control skills are available. If your community doesn't offer Stop the Bleed training, you may request a class through local resources. Please let us know if you will need an interpreter during the class, as many providers have access to in-person or telephonic interpretation. Where can I learn more? A website for the Stop the Bleed program is available here. Translations are brought to you by the Vermont Medical Reserve Corps program and Vermont Language Justice Project. Project funding is provided by MRC Strong.